Welcome back. This is the John Tesh Network with Intelligence for Your Life. My name's Danielle Florence. My guest is Dr. Robert Leahy. He's the director of the American Institute for Cognitive Therapy, an author and editor of 22 books, including The Worry Cure, 7 Steps to Stop Worry from Stopping You. How are you today, Dr. Leahy?
I'm great, thank you. How are you today?
I'm good, thanks. I read recently that anxiety levels are the highest they've been in this country in 7 decades, according to new surveys. What are some of the things that are causing this high level of anxiety in people?
Well, the anxiety levels have been increasing since the 1950s, every decade pretty much, and part of it is the expectations that people have about the quality of what their life should be and what they should possess and how easy it should be. So you have these rising expectations, and reality does not keep up with the expectations. So that's one of the things that you have. I mean, that even though generally speaking, in 2012, people are far better off in every material way that you can imagine compared to 1962, let's say. People's expectations have been growing faster than reality. The second thing is that there's so many choices that people have that they often feel, gee, I don't really have what the best choice would be. And it's kind of an ironic thing that if you, like the 1950s or even the early 60s, if you went into a store to buy blue jeans, you get Levi's, and that would be it. Today, if you go to Bloomingdale's or Macy's or one of these other stores, you might have 30 different brands and 10 or 15 different styles. And the irony of it is that when we have more choices, we often regret that we didn't choose something else. The third reason why there's an increase of anxiety is the increase of uncertainty about life and about work. In the 1950s or 1960s, somebody would go and work in a company or go work in a factory, and they could reasonably expect that they might be working there for 20, 30, or even 40 years and retire and actually have a pension that they could count on. Today, it's very unusual for anybody to have a job that would have that kind of tenure and would last that long. So there's a lot of uncertainty about the workforce and about finances, even though in an absolute sense, people are much better off than they were 30, 40 years ago. Adding to the uncertainty is all the information all the time. So if you watch, cable news, you can get all the bad news all the time. And that leads people to think that the world is a very dangerous place and a very sinister place where life is very difficult. I mean, you never have the New York Times or ABC is never going to open up with the story that everything is pretty much the same as it was the day before, which is reality. So it's going to be the most dramatic and the most bad news coming at you all the time. So we have a lot of there have been there's surveys that have been done in the last 60 years, and you can compare anxiety levels. In fact, in 1997, in one of these surveys, the average high school student was as anxious as the average psychiatric patient in the 1950s. So you've had that increase of anxiety, and of course, one big element of that has been an increase of worry.
I'm talking to Dr. Robert Leahy. He's the author of The Worry Cure, 7 Steps to Stop Worry from Stopping You. Now, how much does technology play into that? You were talking a little bit about the cable news networks that are there 24/7. What about social media, cell phones? Does that add to our anxiety, or does that relieve some of the anxiety?
Absolutely. I think that one of the things that adds to anxiety is the sense of urgency and the lack of boundaries. And what do I mean by that? One is that when you have text messaging or people use their cell phones almost never to make a phone call, but to receive a text message or send an email. So there's a sense of urgency that I've got to respond. I've got to be on all the time. I've got to respond to that text message in the next 3 seconds, or I'm going to alienate my friends. So you have the sense of urgency of information coming at you all the time where you need to respond. And related to that is a lack of boundaries, that it seems like a lot of people feel like I never really get away from work, or I never get away from the demands placed on me. 50 years ago, where you didn't have social media and you didn't have cell phones or email or anything like that, people would send a letter or they'd make a phone call, and they would actually think about what they're going to say before they wrote it or before they said it. And today there's this sort of proliferation of information coming at you that you have to respond all the time. I had one patient who walked into my session with me in his first meeting with him. He's sitting out in the waiting room, and he has his BlackBerry, and he's on the phone. And he walks into the session, and the first 5 minutes of the session, he's talking to somebody else on the phone. And then he sits down and he said, "You can see what my problem is." And I thought that was an extremely helpful way of presenting himself. I mean, it wasn't on purpose. It was just simply he was so he was a BlackBerry addict in a way. He had to be on the phone. He had to respond immediately. So people feel that they've got to respond to so much, and they have a hard time prioritizing. I think a lot of times on Facebook, people feel that they have to. I had a cappuccino this morning, and my 250 friends have to know about it. So you have this sort of sense that you never prioritize what you're communicating, and you're getting inundated with all these messages. My wife and I were in Yellowstone National Park about 2 years ago on vacation, and for a couple of days we had no access to email. And finally, when I got to the email, I realized that 95% of the emails I got were completely useless. And it kind of made me realize that, I was spending an awful lot of time having to read useless emails of people engaged in what I would call I am here behavior, that, oh, here I am, I just want to say thank you or hello or how are you, or whatever. We don't need to hear all of that. But that creates a lot of pressure that you have to respond. You don't have any boundaries. You can't kind of get back into yourself, into your private world. And I think related to this also is the decline of any sense of privacy. Before Facebook came along, and I think Facebook can be useful, but I think it's a largely narcissistic endeavor. That before Facebook, people valued their privacy. They wouldn't want everybody in the world to know that they had a cappuccino at Starbucks at 3:00 in the afternoon, or that they went on a date with Susan or Bill at some restaurant or whatever it is. That would be the private thing. Only a few people would want to know about that. But what's happened with the sense of privacy has been turned completely upside down, in my view, in that now people want to get rid of privacy. They want people to know everything about themselves, every movement, every thought, every feeling, every discomfort that they have. And so, in a sense, it kind of feeds the narcissism that I think all of us are prone to at times, which we think that everybody has to know everything about us all the time. It's kind of like, it's like the generation, me generation, has turned into I am here generation all the time.
And I think there's plenty of oversharing on Facebook as well. My guest is Dr. Robert Leahy. He's the director of the American Institute for Cognitive Therapy. I also read that women are twice as likely as men to be diagnosed with generalized anxiety disorder. Why is that?
Well, I think an easy answer is that they have to live with men. I know that's the answer you want to hear, Danielle. But I think there are a lot of potential reasons for that. I mean, one of the things that's interesting is that prior to adulthood, rates of depression are higher in males than they are in females. And then that becomes reversed, where rates of depression and rates of generalizing anxiety, where a person is worried all the time, which is often associated with depression, that the sex differences change, so that females are twice as likely as males to be depressed, and twice as likely as males to have generalizing anxiety. Some of it can be related to hormonal changes that occur during puberty and then on through adulthood that may account for it. Another can be that females are much more likely to have negative life events such as trauma or assault or rape or other kinds of threatening and traumatic events. So females are more likely to have these negative life events. In addition to that is the fact that women in our society occupy positions of less power and less control. And so when you have less power and less control, you're more likely to feel trapped. You're more likely to feel humiliated. You're more likely to feel helpless, and so forth. I think another factor that we know about worry, when they've done studies on worry, the issue that people worry about most is interpersonal relations. They worry about what people think. They worry about how people feel, and so forth. And women, as you pointed out, women are twice as likely to have generalized anxiety or to be chronic worriers. People who worry tend to be more concerned about the feelings of other people. Females, women in general, high school girls and so forth, are more concerned about the feelings of other people. So one of the positive thing is that women often have more empathy and are better at social intelligence than men are. But the downside is that they become very concerned about taking care of the feelings of a lot of people, and that becomes an impossible endeavor. And so they're more likely to have this kind of generalized anxiety, which can be a lifelong condition for some people if they don't get proper treatment.
I'm talking to Dr. Robert Leahy. He's the author of The Worry Cure, 7 Steps to Stop Worry from Stopping You. We have to take a quick break. When we come back, we're going to talk a little bit about some of the ways to alleviate some of that anxiety. But first, here's John Tesh with some intelligence for your life. Welcome back. This is the John Tesh Network with Intelligence for Your Life. My name's Danielle Florence. I'm talking to Dr. Robert Leahy. He's the director of the American Institute for Cognitive Therapy, also an author and editor of 22 books, including The Worry Cure, 7 Steps to Stop Worry from Stopping You. We talked a little bit about what's causing the anxiety in our world today. What are some of the physical side effects that you see from anxiety?
Well, people who are anxious often end up going to their general practitioner or their internist complaining about physical symptoms, which often are related to being anxious. This includes gastroenterological problems, especially irritable bowel syndrome, difficulty digesting food, aches and pains, feeling tired, having difficulty sleeping. So insomnia is a very common problem with worry. People have headaches related to worry, muscle tension, tingling. So there are a lot of physical sensations of anxiety that often are first detected by your general practitioner. So there's a physical component to worry that we call arousal or physical tension that is there for people with anxiety. I try to make a distinction between worry, which I think of as thinking, something bad's going to happen, I'll fail at this, my mind will go blank. Those are all thoughts, versus the physical manifestation of anxiety, which is the tension, the muscle aches, the dizziness, the gastroenterological problems that people have. So we have physical arousal, which is the anxiety arousal, and then we have worry, which is the thinking part of it.
I hear a lot about cognitive behavioral therapy. What is that, and how does that help with anxiety?
Well, cognitive behavior therapy is what it says it is. It deals with your cognition, which is your thoughts, and it deals with your behavior. So let's say, for example, somebody tends to worry a lot. What we want to do is look at the kind of thoughts that they're having, such as, fortune telling, that predicting that something bad's going to happen, or what we call catastrophic thinking, that it'll be awful if that happens, or tendency to take things personally, it must be all my fault, or mind reading, what are they thinking of me? They think I'm a loser. So we know that people who are prone to depression and anxiety have particular biases that are negative in the way they think. The behavioral component is also extremely important, that people who are anxious are more likely to avoid and procrastinate and not engage in rewarding behaviors. So cognitive behavior therapy tries to help you deal with the behavioral component by helping you set goals, plans every day, engage in pleasurable activity, be a problem solver, confront things that you're anxious about doing that are uncomfortable, practice discomfort as a skill. reward yourself. Those are some of the behavioral components. And the cognitive components are also important in therapy, helping you identify your particular biases in thinking and giving you some self-help tools to deal with them. So it's a highly effective treatment for depression and for every anxiety disorder that we know of. And there's been more research on cognitive behavior therapy showing it's effective, more research on it than any other form of psychotherapy that exists.
My guest is Dr. Robert Leahy. He's the author of The Worry Cure, 7 Steps to Stop Worry from Stopping You. Where does medication fit in when it comes to anxiety? Do you always recommend cognitive behavioral therapy first, or are there some people where medication's really a better fit?
It's a good question. When is medication indicated? For what we call simple fears, like let's say you have a fear of spiders or a fear of flying or a fear of taking the elevator, the research seems to indicate that taking medication can actually make it more difficult for you to learn that you can cope. So with simple fear, where there's a fear of a simple event, like being in an elevator or flying in an airplane or fear of a dog, what you have to do in order to overcome the fear in cognitive behavior therapy is face the thing that you're afraid of doing. So learn how to pet a dog, learn how to get on an elevator, and you have to do this while you feel anxious so that you kind of go through the experience and you realize, even though I'm anxious, I can cope with it. So actually medication gets in the way of that experience where you feel anxious and then you cope with it. So actually medication for treatment of simple phobia would be problematic. The research on combining medication with cognitive behavior therapy seems to indicate that either it has no additional advantage or it has a slight additional advantage. So you have to kind of weigh the pros and cons of taking the medication. Some people can take medication, like for example for generalized anxiety, which is this worry accompanied by physical tension, and or for social anxiety, where you're concerned with what people think. And the medication can be as effective in some cases as cognitive behavior therapy. The problem is that when you stop taking the medication, your symptoms often come back. So, for example, for people who have, let's say, panic disorder, who are afraid of having a panic attack and think that they're going to go crazy if they have a panic attack, what we know about cognitive behavior therapy is that if you do cognitive behavior therapy without the medication, that you maintain most of your gains a year or 2 years after you've stopped the treatment. Whereas if you stop the medication, you're very likely to have a rebound later of your symptoms. Having said that, what I say to patients who have social anxiety or generalized anxiety or a depression, that you can look at medication as an additional tool that you can use. So you never want to withhold medication from a patient or discourage them from using medication as part of their treatment program.
My guest is Dr. Robert Leahy. He's the author of The Worry Cure, 7 Steps to Stop Worry from Stopping You. What about people who just are having anxiety? It's not really that big a deal. What are some steps, what are some things you can do to stop yourself from being more anxious just around the house or on a daily basis?
All of us are anxious because we're human beings, and we often have to cope with things that we think are threatening or difficult. But if you think about the issue of worry, which is these repetitive negative thoughts about the future, there's several things that you can think of as coping mechanisms. Like, for example, in 2 weeks I have to give a talk at a conference in Washington, D.C. I could ask myself, do I have a plane reservation? Will I be able to get down there? That could be my worry. It took me like 30 seconds to get that one out. The question would then be, is there any action I can take today to solve the problem? Do I have a plane reservation? As it turns out, I actually do not have a plane reservation. So what's the productive action? What's my to-do list today? My to-do list today is to make a reservation. I'll go to Expedia.com, make a reservation, solve that problem. That's my to-do list today. That's what I would call productive worry. Productive worry is something I can do today to solve the problem. Unproductive worry would be a whole string of what-ifs. What if people don't like my presentation? or what if I get a headache, or what if I get food poisoning, or what if my plane is delayed. There's nothing I can do about that. That's unproductive worry. So I need to set that aside and say, well, that's not going to be very useful for me to worry about that. So what do I do with that unproductive worry? Well, I can say I can accept limitations and I can accept uncertainty. The uncertainty part is a key element of worry. People who are chronic worriers tend to think if I don't know for sure, it's going to be a bad outcome. So they might think if I don't know for sure that my talk is going to go well, if I don't know for sure that my plane won't be delayed, then it'll be a bad outcome. Most of life involves uncertainty, but worriers tend to think that that uncertainty is going to be a bad outcome. They actually did a study where they asked chronic worriers to predict what's going to happen. And they followed up and actually found out what happened. 85% of the things that people predicted would have a bad outcome had a neutral outcome or a positive outcome. So 85% of the things that you worry about actually turn out okay. Well, how about the other 15%? They found out that worriers said 78% of the time, but I actually handled it better than I thought I would. So, you can think about what chronic worriers tend to do. They tend to be living in a world that 85% of what they are predicting is not going to happen. And then they underestimate their ability to handle real problems. You're probably, if you're a chronic worrier, you're probably really, really good at handling a real problem when it really exists. But you're probably really, really bad at handling 85 problems that don't exist. But you don't have to handle all the problems that don't exist. You only have to handle problems that do exist. And a lot of times, worriers found, I actually was better at handling the problem when it occurred. I was actually less anxious when it actually occurred because I actually had something to do. I can go into problem-solving mode. I'm actually pretty good at solving problems. So I think it's a key thing that maybe you're really good at coping and you're really good at solving problems. We tend, when we're anxious, we tend to think that there's some threat that's going to absolutely be catastrophic, as opposed to maybe there's a threat, but maybe I'll be able to cope with it in a way, and maybe I'll be able to come out the other side, and maybe I'll be able to deal with it. I mean, one of the things I ask worriers to think about is, what did you worry about 5 years ago? What did you worry about 5 months ago? What did you worry about 5 days ago? I was asking a journalist about this a while back, and she said, I know very well what I worried about 5 years ago. And I said, what was that? And she said, I worried I'd get divorced. I said, well, what happened? She said, I got divorced. I said, well, how did you handle that? She said, well, at first it was difficult, but then I realized it turned out to be for the better. So a lot of times, certainly bad things happen, but a lot of times people who are chronic worriers are pretty good at coping with reality. But none of us none of us are good at coping with fiction. We can't solve problems that don't exist. It's just impossible to do.
My guest is Dr. Robert Leahy. He's the director of the American Institute for Cognitive Therapy, an author and editor of 22 books, including The Worry Cure, 7 Steps to Stop Worry from Stopping You. Thanks for talking to me today, and good luck on your speaking engagement. I think you've got it all under control.
Thank you, Danielle. Thanks for having me on. I appreciate it. You take care.
If you've got questions for our experts, you can post them on our Facebook page. It's facebook.com/John Tesh. You can also leave us feedback and make suggestions of experts you'd like to hear us talk to. You can also follow John on Twitter and Pinterest. Coming up next, I'll be talking to Rosemary Hafner. She works for CareerBuilder.com. They just posted a new survey that says that 1 in 3 people who call in sick to work aren't actually sick. I don't think that's surprising, but you'll want to hear some of these excuses that people give, and also how calling in sick when you're not really sick can backfire, especially in today's world of Facebook. First, here's John Tesh with some intelligence for your life.